My name is Alex Rowley. This is assignment 4 for pharmacology for Aspen University. We will start out with the real world scenario and the critical thinking questions. So the first question is, based on your first impressions of this patient's actions and appearance, what do you suspect she is suffering from? Let's go over some of the symptoms. She is combative and screaming that she needs a bottle. She is bleeding and disoriented. Her hands are shaking, and she smells of urine and body odor. Now, automatically, my first thought is, alcoholism. Alcoholism has the tendency to cause all of these symptoms. It can make people, combative, and she may be going into withdrawal. That's why she's shaking and screaming that she needs a bottle. She fell. It definitely messes with your sense of balance, and people that are severe alcoholics will fall quite a bit. I'm actually in recovery myself, and that's something that I've dealt with. Smells of urine and body odor. At a certain point, she probably stopped taking care of herself. Her alcoholism kind of took over her life. So I suspect that it is alcoholism, and it could be a sort of mental illness as well. Let's see, the second question is, what short and long-term health risks would I suspect that the patient faces? Some of the short-term effects of alcohol use are trouble concentrating, loss of coordination, mood swings. Those are just some of the short-term effects. Some of the long-term effects would be permanent brain damage. I know that alcohol can mess with some of the gray matter in your brain, memory loss, alcoholic hepatitis, and liver cirrhosis. That's really far into late stages of alcoholism. You'd have to be drinking for consistently for around 10 years, I think, in order to develop liver cirrhosis. And at that point, the only option would be a liver transplant. And then high blood pressure, increased chances of stroke because of the high blood pressure, and a irregular heartbeat. Some alcoholics will suffer from what's called cardiomyopathy, and it's heart problems caused by alcohol. Many people don't think about the effects that alcohol can have on all parts of your body. They usually just think of the liver and maybe the kidneys, but it will definitely negatively impact your heart and your brain. I know that I suffer from some memory issues, some short-term memory loss from when I was drinking. See, the third critical thinking question is, why do you think the patient's hands are shaking, and what do you think causes her confusion and combativeness? I think the shaking can be DTs or delirium tremens, which is a symptom of alcohol withdrawal. Alcohol withdrawal is very dangerous. I think as far as substance abuse withdrawals go, I think the only one that's more dangerous is a benzo withdrawal, because you can die from benzo withdrawal and alcohol withdrawal. Alcohol withdrawals can include seizures, hallucinations, confusion, and like I mentioned before, it can be deadly. What assessments do I think are needed for this patient? I think the most important thing at first would be to stabilize the patient, obviously. Maybe, run some tests on her liver, kidneys, maybe her heart, just to make sure that she is stable. And then after that, I would attempt to give her a substance abuse evaluation, as well as a mental health evaluation. Many addicts and alcoholics suffer from dual diagnoses, meaning that they suffer from more than one issue, such as, alcoholism and depression, or, heroin addiction and anxiety, or, benzos and schizophrenia. So I think that it would be very important to give her a substance abuse evaluation, a mental health evaluation, and then attempt to see if there's any mental problems, from a doctor. And I would also try to give her some treatment options and resources for recovery groups, such as AA, NA. I know that many hospitals have resources that treatment centers will provide to them in order to get patients. They'll give them pamphlets and numbers to call. So I think that would be a good idea for this woman in her case, is to try to connect her to a treatment center, an affordable treatment center, as well as any recovery groups. And then the part two of this Let's see. So many mental illnesses, they're treated by a combination of medication and therapy. That's usually the best way to treat many mental illnesses. For instance, many doctors will prescribe an antidepressant if they're suffering from depression or anxiety, and they will also get them into some sort of psychotherapy, like cognitive behavioral therapy, group therapy. So I think that's usually the way to go at first. The problem is many mental illnesses aren't seen as serious and drastic as physical illnesses, especially to insurance companies. Okay, so deductibles and copays used to be higher for mental illness treatment. The laws kind of changed a little bit, and they're slowly changing that, so that is a positive. But many insurance companies still do the bare minimum and are much more strict with mental illness. They kind of just do enough to make sure that the patient is stabilized without attempting to treat the underlying issues. The change really needs to happen at a federal level, and it is something that you feel passionate about. It's not a bad idea to write your congressman and try to get involved that way. Because if they're allowed to treat mental illness, the insurance companies, if they're allowed to treat mental illness as more of an afterthought than a real issue, and they're going to, if it saves them money, then that's what they're going to do. So I think that the change would need to happen at the federal level. I saw that quite a bit. When I was early in my recovery, I have attended treatment multiple times, and I would see people that their insurance covered for 2 weeks or 30 days, but they really needed more help, and they were just kind of at that point kicked out. Mental illness, depression, anxiety, schizophrenia, those are big issues in this country, and they can also lead to substance abuse issues, which, as we all know, are a huge issue with the opiate epidemic happening right now. So my advice would be, if you're looking for an insurance, and you suffer from mental illness, try to find one that has a good policy on mental illness. If you can't afford it, or your insurance doesn't cover it, see if you can, get some sort of Medicaid, or find, maybe a cheap, a less expensive therapist, because some work on a sliding scale and are willing to help out a little bit. So that would be my advice in order to make some sort of a difference with the way that insurance companies treat mental illness, and you or whoever as a patient handle their own mental illness while trying to negotiate with the insurance companies. Thank you very much, and have a good rest of your day.